Here at the KSMO studio, it's time for our spotlight on the Salem Memorial District Hospital. And we have from the laboratory. I always love that from Frankenstein, the laboratory. We have Mr. Jim Renfrow. He's our new guy. Jim, how are you?
Doing fine, sir. How are you?
I had a chance to meet with Jim, and we did some commercials over at the hospital. It was the first time I had met him, and he came in, did his commercial, and then promptly went right back to work. So
Correct.
Didn't have a lot of time to visit with him, but thank you for coming in and spending some time with us. Actually, on my schedule, I have Lisa Delaney in for today, but that's okay. I'm not proud. We can always fit you in. Anyway, it's good to actually meet you and have a chance to sit down and talk. So what we, Jim and I were talking about before we came on the air, actually, is just how important the laboratory is. We all know the hospital went through a time. We had to go through a transition. We've gotten through that transition. Things have gotten back to near normal to where everybody can count on everything the lab does. And that's very important because, as Jim and I were talking about, you go to the doctor, you get your blood work done, and what's the first thing that they look at?
Lab work.
The lab work.
Part of that.
Yeah. It's not the whole solution, but it may be the very first part of what your physician sees and then wants to talk to you about, isn't it?
Yes, sir. It's extremely important. It's just a piece of the puzzle. Of course, you have radiology, et cetera, if that's needed, et cetera. But 70 to 80% of the diagnosis of a patient is based upon lab results. Mm-hmm. And it's extremely important, like you said, that patients and physicians have confidence in the laboratory. And throughout the United States, laboratories are inspected on a regular basis. Mm-hmm. At least every 2 years or so, and surveyed either through accreditation or by CLIA, which is the state. And so that's how that's monitored. And all the personnel who work in the laboratory, as far as who perform the testing, has to meet certain criteria. The laboratory is the most highly regulated area of really the hospital itself, all of the United States. So the federal government regulates that as far as those guidelines. It's around 300 standards that must be met in a clinical laboratory.
Well, and I won't even ask you how many tests the laboratory can do because that just like be infinite. It's just there's a whole bunch.
Yes, sir.
And
it's growing every day.
It's growing every day. And there's infinite uses to what you can do with the lab. We talk about obviously people with diabetes, that A1C. You definitely want to monitor that all the time. Right. But also people with high blood pressure. You got cholesterol problems. You got triglyceride problems. You just can't go to the scale and look on the scale and I weigh 188 pounds, and I wonder if my triglycerides are up. It doesn't work that way, does it?
Yes, sir. That's correct. It's just a piece of the puzzle, and all of that the clinician will take a look at, like you just described, along with particularly lab tests and other things, and make the diagnostic decision and the plan of action in regards to how to treat a patient.
You know, we were talking before we got on the air a little bit about the old health fairs, and I know the hospital's not doing that, but they are offering very low-cost lab prices right now that anybody can go get at any time. Mm-hmm. And here's the neat thing about getting your lab results, and Jim and I were talking about this, the old health fairs, you go and you got your low-cost health work done, your blood work done, you got all the tests you needed, and a lot of people would take them and they say, "Oh, great, I'm healthy," and they walk away and they throw it away. And I was telling Jim, I've kept all mine from the very first health fair I went to. I got every single one. And when you do that, you can track your health through those lab results from the very first one I went to. You can watch where your triglycerides are, maybe your cholesterol levels, you're very low or very high, and you get the uric acids, you get any of the tests that you need to make sure that are very, very important to your health are right there on that. We're right there during those health screenings. And you can take a look at it. It's a snapshot for that day, but if you've got 25 snapshots, you got a pretty good record of your health, don't you?
Correct. And, like I was saying earlier, you're in getting that information to your clinician, like say if you change physicians or whatever, your provider, make sure you give them that information. And, of course, more than likely they will order some additional testing at that time to get another snapshot. But it's important that you be part of your health care and that like you're mentioning, be involved and ask questions of your clinician. If you, like I said, if you have any questions, ask.
One of the things I think when people when they if they have pain, they go to the doctor and they get okay. A lot of times they can't treat it that day, so then they'll give them something for that pain. That can affect your blood work drastically, and so some people might say, well, and that's why a lot of times you go to the lab, are you taking any medication? That you need to know that because it can sway the results, right?
Correct. One of the important things in certain tests, is whether or not a patient's fasting or not. And physician's office will let you know whether you need to be fasting or not at that time before you have this particular lab work done. So it's extremely important that you ask those questions and communicate, with the clinician what medications you're on. If you change physicians or have a specialist or something like that. I'm getting ready to establish my physician here, for example. I'm going to have all of my information and my meds, et cetera, to let them know what meds I'm on, and that way they can better treat me as a patient.
But a lot of times I think when people go to the doctor and they say, I need to go get a blood test, I just had one. They don't realize that they're using that to look at the results and see if either the method of healing is working with the prescriptions they're giving you, or maybe they're affecting some other bodily function. As we mentioned, maybe you don't have a problem with uric acid. You're taking some kind of medication. Next thing you know, your uric acid's over 10, and you're complaining about your big toe because you might be getting gout. Prescriptions react differently to every single person, don't they?
Yes, sir. Yes, sir. And that's why it's important that you communicate with your clinician on those. And because when they give you another medication, before they give you another medication, you need to know what you're currently on,
Sure.
et cetera. If you change physicians, give them all the information that you have.
Jim, how important is drinking water for a lab test? You hear about people saying well hydrated, and I remember one time my doctor said, you're not drinking enough water. And I said, well, how the heck do you know? And he goes, your blood is very, very thick. You need to keep drinking water. How important is it?
It's important, especially when you come to, be drawn for lab work. Like yesterday, we were at a particular location in regards to doing screening, and we had an individual that it's very difficult to get a sample from, and we asked her to do a little timeout for a while, 30 minutes, 40 minutes or so, and then hydrate. In other words, we gave her some water to drink, etc., and then we were able to get her specimen. It's important that we hydrate, as we go along in life anyway, but on a regular basis. But that's up to your clinician too. Just make sure you follow his or her recommendations and all
Right.
that. But sometimes we do have patients that come in that need to be hydrated a little bit.
Yeah, and a lot of times that will show up in that blood work. If you take it, your creatinine levels all of a sudden getting a little weird, and it should be a lot lower. Maybe you're not drinking enough water, or maybe you're drinking too much sugar.
Right.
And that can throw things off too. And so you get little warning signs, don't you, as in the lab?
Yes, sir. Yes, sir. And just communicate. In my main theme here is to communicate with your clinician, and make sure you're doing what they advise you to do in those cases, and everything should turn out pretty well from that.
When you do a lab test and you get, and I know this can happen, you see the results come out and they just don't look right. And, a lot of times, I remember one time I had a lab tester on. I was playing hockey at St. Louis University, so I was at St. Louis University Hospital. They did the lab test, and they came back and said, we need to take another one. The results don't look right for somebody your age. We want to see if there was something, maybe air, something got corrupted, something got in there, and when they took the second one, it was fine. Right. Sometimes there are false readings, right?
That it happens, and that's when the clinician, physician, or provider will decide on, hey, we need to do a repeat or something like that. And of course, we can't do a repeat unless there's an order.
Right.
That's federal law.
Right.
But or any testing.
And it has to be a new sample.
It has to be a new sample.
Yeah.
And so that's when we would recollect, and then they would review that from that.
But that has nothing to do with the lab, and that's what I want to tell people, because sometimes it does happen.
No, no, sir.
Yeah.
There are things that do occur. Nothing's perfect in life,
No.
unfortunately. But not everything's perfect. Let's put it that way. But it's up to the clinician whether or not we should repeat that. And of course, we'll have an order for that
Right.
by federal law. But basically, they would make that decision, and of course, we do that.
So, as we mentioned, there are some very low-cost lab tests now that the hospital is offering at super extreme rates.
Right.
You do still need an order for that, though, right?
Yes, sir.
Yep.
Yes, sir. And just basic chemistries, hematology, which is the CBC, things like that. So we do provide that at those low costs. Yeah.
Nothing wrong with low cost, right?
Amen to that.
Now, this is our first time to talk to you. So, first off, Jim, where did you come from? Our first meeting was at the hospital
Yes, sir.
library.
Yes, sir. Well, I'm a Kentucky boy.
Okay.
Born and raised in Lexington, Kentucky. And
Horses?
Yeah, I did get to meet Secretariat. I know that for a fact. But basically, I grew up in Lexington. Went to school there, high school at Bryan Station High School there, and went on to Eastern Kentucky University. And then from there, I went to my specialty in transfusion medicine. I went to University of Texas Medical Branch there in Galveston, Texas. And I've been mostly through the South and in those areas. I've been in primarily started out in supervision in the laboratory right from the start, within about 8 months out in the field, and then went on to management and then director positions, and taught some. I went into as far as a surveyor for clinical laboratories all over the United States, east, west, north, and south. Cold places, warm places.
Wow.
But I traveled all over the United States. That was great. And I've done about 1,500 labs in accreditation and survey.
You've been around.
Yes, sir. Yes, sir. And that was a vast experience. I really wanted to get into that to learn more about the surveying aspects.
I see.
Therefore, I could be a better manager and director. And so when I do go through a survey process, I'm almost, it's kind of eerie, but I know what the surveyor is thinking.
Right.
So I'm better able to be prepared for that. A good part of the survey itself, or accreditation, is really the surveyor. There are the standards, around three criteria, as we call them, around 300 or so, and they're growing about every year.
Probably every
the standards.
week, more than likely.
Yes, and because of the specialty testing that's out there now. But basically, I have to be in tune as a director and in management of what's coming. So basically, that's how I keep myself up to date with everything. I read constantly, and I listen to the surveyors as well. It really gave me a good snapshot of what goes on. And in 2016, I got Surveyor of the Year with COLA. That
Well, congratulations.
that
on
came
that.
from the actual labs themselves and my coworkers there in Maryland. But I was really proud of that. When I got it, I said, "Oh shucks," one of those things. But
It did make headlines in the local
no,
paper.
it didn't. Yeah. But I really enjoy what I do, and every day. There's never a dull moment. We've got a great team at SMDH, so combined, I would say we've got right at everybody the medical technologists, the MLTs, and myself, and phlebotomy. We've got a combination of probably about 100 years experience. Between me and Joe, there's right at 70 years experience in clinical laboratory. So we've got a good crew. They work really hard. I'm so proud of them. every day. Kind of choke up a little bit, but
Well, that's good. I mean,
basically they really work really hard, and so I really enjoy what I'm doing, and we can't get it done without those type folks.
right.
They
Makes
put their
coming to
heart
work
into it.
fun when
Yes,
they,
sir.
when, you know, when they all
It's-
when you work as a team, doesn't
Yes,
it?
sir, as a team. And the whole organization, SMDH, is wonderful. So I think that the facility there, the organization at SMDH, I think the community is very lucky to have this and the healthcare here. Of course, we're always planning for the future. And so we're very excited for the future.
Well, we're very glad to have you. And I guess one of the questions that, I mean, it sounds like you have a lot of history, so I can ask you this question.
Yes, sir.
But how many change? I mean, it changes every day. But
Yeah.
how many changes in procedures of lab work have you seen over the last 10, 15 years? I mean,
Oh,
they've
golly.
got so many. They've gone from test tubes and slides
Yes, sir.
and strips and I mean, it's the the technology. You have to learn all this in the lab,
The
don't you?
technology is ever changing,
Yeah.
and it's usually for the good, for sure. But it's amazing. When I came on board in medical field, we were doing a lot of manual testing, test tube type testing, and things like that. Nowadays, it's a lot of automation, a lot of technical, highly technical. When COVID came around. And I was with Baylor in Fort Worth, Dallas area, there, and just COVID itself has come a long way. They come from basic swab testing and basic small analyzers on up to the PCR testing.
Right.
And that's come a long way electronically within the last, 3 years now. So it's ever changing. New tests are coming out, new ways of performing the test. And there's 3 levels of testing. There's wave testing, which is like you would see like in physician offices or things like that, and then moderately complex. Some of those are in physician offices along with the main labs. And then high complexity. That's some things like PCR that you have your COVID confirmation done on.
Right.
And I've surveyed those labs too. But basically, in drug confirmation, that's another example of high complexity testing. So it's ever changing, and you've got to keep up with it. Because we want to keep up with it, because we want to provide the best testing for our patients.
It's a
And
challenge,
it's a
isn't it?
challenge.
And you meet that challenge. That's what drives you, doesn't it?
Yes, sir. Every day.
Yeah. I was going to say, 'cause you look like you're ready to take on the next challenge.
Yeah, yeah.
You came here.
Yeah, that's it. I got you.
All right, very good. Well, I've just been rattling on asking you the questions that I have. If you had anything that you needed to talk to us about today besides what we just did, I'll be more than happy to hear what you got to say.
Well, basically, of course, I'm tickled to death to be here, and I'm proud of our team at SMDH, and we're looking at new testing for the future, and we brought, for example, A1C on board testing in house. We do not have to send that out now, and we are in the process of switching from Quest Diagnostics as our
Right.
primary laboratory to LabCorp. That will be coming up around the first part of September, mid-September.
That's soon.
Yes, sir. Right around the corner. And we'll still have Quest for those patients who their insurance requires Quest as their secondary testing or their reference lab. So, but our main reference lab will be LabCorp. So we're going. That's a very positive change. And we'll be able to, now we're having to scan in all of Quest testing. We have to scan all that information in, hand by hand. With LabCorp, it all would come across electronically, so we
see.
won't have to worry about that. But everything's, that's some of the big things on the horizon. And so it's ever changing. We have to keep our minds our ears to the rail, so to speak, and seeing what's new coming out there new in this field, and we're there to meet the challenge.
Well,
So
we
we're ready to
appreciate
go.
all you do, and that you came to Salem, and we definitely appreciate that and what you have done with our lab. And of course, we all know we struggled for a little while, but
Yes,
we
sir.
are back on top of the game again, and that's the neat thing. And as you mentioned, we're just still driving forward to get it bigger and better all the
Yes, sir.
time.
And our medical director, by the way, Dr. Shaw,
Mm-hmm.
he's on board with all of this as well. So we're all working together to get it done.
Fantastic. Jim, as always, we appreciate it. Mr. Jim Renfrow from the Salem Memorial District Hospital Lab. And, of course, how important our lab is. Anybody that's been in a hospital knows if you've had labs, you know what I'm talking about. He's the guy behind the scene. You don't see him, but you sure know about him.
Yes, sir.
No doubt about it.
Yes, sir.
Thank you, sir, for coming in and
Thank you
spending some
very
time
much.
with us. In our spotlight on the Salem Memorial District Hospital, we are going to come right back. We have Civic